Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's Climate Change and Health series is a special collaboration among the Blum Center, the MGH Center for the Environment and Health, and the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has been muted so we can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I would like to introduce you all today's guest speakers. Joining us today, we have Dr. Patrice Nicholas. Dr. Nicholas is Distinguished Teaching Professor and Director of the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. She is also the co-director for policy and advocacy of the MGH Center for the Environment and Health. She teaches in the Doctor of Nursing Practice program and advises accelerated Bachelor of Science in Nursing students at the MGH Institute. She also serves at the MGH Center for the Environment and Health on behalf of the Department of Nursing and Patient Care Services. Joining us, we also have Samantha O'Neil. Samantha is the oncology nurse specialist at Spalding Hospital for Continuing Medical Care in Cambridge, Mass. She started at the facility in 2018 as a night nurse on the oncology unit and entered into her current role in the education department in the fall of 2021. Samantha is currently enrolled in the MSN program at Southern New Hampshire University with a focus on population health and is anticipated to graduate this October. During this last semester, Samantha worked alongside Dr. Nicholas to learn more about climate change and used her oncology experience to provide insight on how cancer patients are impacted by the effects of climate change. They join us today to give a talk on climate change and extreme heat in 2023. So please join me in welcoming Dr. Nicholas and Samantha.
Thank you, Amy.
Thank you so much.
I'm just going to share my screen. Can you see my slides? Wonderful. So as Amy mentioned, we've had the good fortune to partner with the Blum Center for a monthly webinar series covering the myriad consequences, health consequences of climate change over the past year. And today's session launches our quarterly approach. Because of the events of this past year, with extreme heat throughout the United States, Samantha and I thought it particularly apropos to cover climate change and extreme heat in 2023, the heat wave of the future, and ways to protect against heat. Before I go on, I'll mention two facts. Number one is that many people watch this program asynchronously, very large numbers. So some join synchronously, as all of you have who are participating now, but we also have large numbers who watch on their own time. So that's wonderful too. I will also share that Samantha, Amy, and I saw on the news this morning the extreme heat in the United States today, with a particular focus on school children going back to school. And this is especially true in the Northeast United States. We know that the Southwest and Southeast United States were disproportionately hit by extreme heat nearly all of the summer. But here in the Northeast, school children are grappling with extreme heat, many in older school buildings and many without climate control or air conditioning. And we'll touch upon that further in the presentation. So in our discussion today, I'll briefly touch upon the background of health consequences of climate change, but we'll really hone in on heat-related illness. Then we'll focus on climate change and extreme heat and what the heat challenges are. And then extreme heat in 2023 in our climate changing world, the importance of climate change communication. So Samantha and I can't underestimate how important it is for those of us to be aware about extreme heat, and whether you're a health professional or a member of a community, to be sure to warn others about extreme heat in your communities. And then heat vulnerable populations and extreme heat. This is just a lens from our Center for Climate Change, Climate Justice, and Health here at the MGH Institute of Health Professions. When we launched the center in 2017, we developed a mission, vision, and core values and a logo, and we're very proud of our website, which is continually being built. This slide actually shows you how a changing climate can actually affect health. And it shows you the ways in which climate change is occurring. So, for example, increased global temperature in the orange left-hand column, extreme weather and disasters, precipitation extremes, sea level rise, and changes in land use and growing seasons. And then you can see in the light blue column, extreme heat at the top, because it's the major health consequences that occur in the United States and worldwide. And then the other consequences are also listed: air and water pollution, reduced food and water quality, changes in infectious diseases and vector transmissions. And I know at Spalding Rehabilitation Hospital, they have a clinic for chronic sequelae of Lyme disease, which has become an emerging problem, and then allergens. And then in the next grayish blue column, you can see heat-related illness as a major area of focus, and we'll be touching upon that. And then early warning and preparedness being particularly important. Prevention or reduction in heat-related illness, for example, community engagement, and we'll talk about responsibilities of citizens in communities, and also communities for warning systems for heat, education and awareness, and adoption and integration. And the rest of the slide shows social, behavioral, and environmental determinants of health, where one lives, whether you're impacted by poverty and housing, diversity, equity, and inclusion, access to healthcare, and then examples of needed research are highlighted at the bottom. So on this slide, you'll see that it's from the Lancet Planetary Health. And at the top, it shows the various types of impacts related to climate change. On the far left is heat-related illness. And then you can see evacuation, trauma, anxiety, and PTSD. There are a lot of mental health impacts, asthma and chronic obstructive pulmonary disease from greenhouse gas emissions, particularly from industry and automobiles, infection, malnutrition, and others. Regarding health, heat-related illness is the major poor health outcome from climate change. And you can see below that is heat stress to inpatients. And there are several, particularly in health systems, there are several solid studies that talk about visits to emergency departments for heat-related illness. So that's an important avenue for treatment of those impacted by heat illness. And then the social and structural determinants of health are in the next line: housing damage, reduced equity depending on where people live, and disproportionate exposures to heat. And then the ecological determinants of health. So, for example, extreme weather, of which heat is one of the major impacts. This map shows the Northeast. And what we know from this past year is we were impacted by extreme precipitation as in rain, and also including the state of Vermont, which had flooding. And we just had a lot of precipitation in the Northeast. July was the hottest month on record in the United States and for the Northeast, but we had a milder August, and now heat is ramping up, impacting school children. Heat waves were particularly problematic in the Southeast and the Southwest. Temperatures reaching 120 degrees and above in areas like Phoenix. My daughter-in-law's family is in Phoenix, and my son and daughter-in-law visited with 2 small children, and they literally went from pool into a climate-controlled, air-conditioned environment. But there were people who were homeless, occupational workers, and some who actually acquired third-degree burns when they fell onto hot pavement. So it's a serious problem. So the threat of heat, each year there is an increase in heat-related emergencies from the north to the south, and mortality risk has been noted to rise significantly by 8% for each degree Fahrenheit increase in daily temperature. It's also well established that out-of-hospital cardiac arrest related to heat has been found to be most significant in those with diabetes and those with cardiac comorbidities. And a 1% centigrade increase in temperature has been associated with a significant increase in morbidity due to arrhythmias, cardiac arrest, and coronary artery disease. And heat stroke, which needs an immediate 911 response with rapid external cooling, resuscitation with fluids, and supportive therapy is necessary. These are the hottest days on record, and you can see the white line is 2023. This is from Climate Central, and you can see that the line stops in just before August when this data was collected, but it was on the rise significantly more and surpassing 2016, 2020, 2019, and 2017. We know that 2023 was the Earth's hottest month, July being the hottest month ever recorded. And the year-to-date temperatures, the global surface temperatures, ranked warmest in the 144-year record of data collection. And this follows June, which also set a warmest June record from the National Oceanographic Association, which have been collecting data since 1850. And of note and of concern, global ocean surface temperatures also hit record highs in July, which marks the 4th month in a row with record-breaking ocean surface temperatures. And we know this is a bellwether for concern for marine life and particularly for industries such as fisheries. This again is a lens on 2023 as the hottest year on average. You can see the record warmest areas in the dark red are significant in several areas, including the southeastern and southwestern US, the areas along the Africa coast and the Western Europe coast, areas of Central America and South America, and others. And this is the urban heat island. It's a very interesting phenomenon, which is linked with heat-related morbidity and mortality. And you can see that on the left axis, the temperatures after sunset have been collected. And you can see that for central business districts and areas in cities where people live, the temperature is significantly higher, 23 degrees centigrade, than areas in rural communities, which may be far lower, for example, 19 degrees. So what you know about that is that people who reside in those central business districts and urban residential areas are very much impacted by higher heat. And of note is that the buildings reflect heat because of windows and concrete and asphalt that's concentrated in inner cities also reflects heat, which impacts health. We'll talk a little bit more about that further along. And then this is the National Weather Service Heat Index, and it illustrates the likelihood of heat disorders with prolonged exposure or strenuous activity. You can see on the left axis is relative humidity in percent, and at the top you can see the temperatures. So if you look at 98 degrees, which could be a temperature that Boston would achieve, and you go down to 65% humidity, which is not all that unusual for the Boston area, you can see that that would reach extreme danger, equivalent to 128 degrees Fahrenheit. In Phoenix, where temperatures reached over 110 degrees, and if you look at 110 on the far right, however, relative humidity might be far lower, say 40%, that's equivalent to 136 degrees in the heat index. So an area for lots of concern throughout the United States, whether areas have relative high humidity or low humidity. This is an important function in addition to what the temperature is. So I'll hand it off to Samantha. Thanks, Samantha.
Yeah, thank you, Patrice. So for a few of the things we've already kind of reviewed, Patrice has mentioned in the first few slides how we're gradually seeing an increase in temperatures. So we thought it would be important for a review also for us all to be aware and educated on the symptoms and management of different heat-related illnesses. We did already kind of mention heat stroke, but there are also heat illnesses that could present prior to that emergency happening. So the first illness we'll kind of go over would be heat cramps. So this may present as individuals either they're heavily sweating or having painful muscle cramps or spasms when in a warm environment. So if either or both of these symptoms were to occur, it'd be recommended individuals should stop whatever activity they're doing that precipitated these symptoms, rest for a few hours, and hydrate with either water, juice, or a sports beverage. If those symptoms, however, do persist, it is recommended that you seek help, medical attention, and just keep an eye on their symptoms during that time period. Next slide.
Mm-hmm.
So after heat cramps, if it's something kind of that comes afterwards, will also be heat exhaustion. So this does present with more symptoms than you noticed with the slide previously regarding heat cramps. An individual may report for this scenario heavily sweating, having fatigue, dizziness, or headaches. They may even be nauseous or vomiting, experience irritability, fainting, and of course there's also thirst that might be described, and also a decrease of urine output, so kind of symptoms of dehydration. In later slides, Patrice and I will mention that although it can be challenging for patients to access AC, this is a recommended treatment and a very effective one. So patients should try to access either AC or cooling centers if possible. Patients should also lie down, loosen any restrictive clothing, drink slowly, either water or other types of beverages, but avoiding any beverages that have alcohol in them. And cooling or bathing in cold water also could effectively cool down to prevent heat exhaustion from progressing. But for some patients, if they are very exposed to heat and experience heat exhaustion, they might be having uncontrollable movements or vomiting. So in those scenarios, individuals should place the patient, or the person I should say, in a position that's safe for them, and seek out medical attention, because that can progress to a medical emergency. And then we come to heat stroke, which we mentioned previously. So this is a true medical emergency where the individual can be experiencing one or all the symptoms listed on the side of this slide. So your body temperature has increased to very high temperatures. The individual might be having mental status changes, confusion, or dizziness, may experience a throbbing headache, along with maybe nausea and their body itself could have hot, dry skin or be profusely sweating. Or someone might be become unconscious if they've really progressed to a heat stroke. So you would want to call 911 immediately and get medical attention for this individual. Try to reduce their body temperature with however you can with the methods we've previously mentioned, and kind of keep them in a cool place out of the sun. Compared to with heat cramps and with the heat exhaustion, we actually would not want to give liquids in this scenario. So we would be seeking medical attention, especially if these symptoms worsen or are greater than an hour that they experience them. And as the summers are becoming warmer and occurring for longer lengths of time, there are more concerns for dry conditions and droughts. These conditions then subsequently can lead to wildfires. This summer alone, we have seen some devastating wildfires in Canada and Hawaii, for example. So not only is this concerning for people living in proximity or right near the fires, but wildfires themselves can impact individuals living far distances. Some people kind of in the Northeast were able to even see the smokes of the Canada wildfires this summer. So for concerning with wildfires, air pollution is one example that we are worried because the carcinogens from the fires can travel long distances, and then these pollutants can contaminate different water sources or soil. Research has noted that exposure to these carcinogens can be harmful to health of individuals who are exposed. So if you're exposed to these smokes, research has shown there is risk for certain cancers such as lung, brain, non-Hodgkin's lymphoma, multiple myeloma, and leukemia. In this slide here, me and Patrice have included, it displays information regarding a recent workshop, which was offered by the National Academies Organization. The workshop was focused on communities, climate change, and health equity. So this program was a great opportunity for individuals to learn about climate change and specifically learn about the inequities in heat-related climate change impacts specifically. And then Patrice, I believe I'll hand it back over to you.
Thanks, Samantha. This slide is from Healthy People 2030, which is, as many may know, a document that comes out every 10 years to identify successes and goals and objectives for the health of the US population. This slide is really helpful in looking at social determinants of health. So, for example, on the right-hand side, we know that healthcare access and quality are critically important as a social determinant of health. Related to climate change and particularly extreme heat, the neighborhood and built environment are also critically important. And we'll talk a little bit more about that further in the presentation. But where one lives, how safe the environment is, access to trees and tree cover, and how much building is around, and concrete and asphalt. And then the social and community context is critical. So a close social community can actually protect people around climate change related problems, particularly heat related. Economic stability is important. Those with more economic stability often have more access to opportunities that limit climate change related problems, most notably air conditioning as one, and then education, access, and quality. And we'll talk a bit about schools and students' education further along. So this is a cooling center analytic framework from the Centers for Disease Control and Prevention. And you can see at the top, a cooling center and related educational campaigns should be an intervention. Vulnerable populations without easy access to a safe, cool environment are the population of concern. And then there should be awareness of heat-related health impacts and awareness of cooling centers. And what we know is that the lay media does quite a good job in educating, for example, about heat-related impacts. as far as awareness of cooling centers, I live in the city of Boston, and they do have a phone service that calls all residents to make them aware that there's a heat-related event and that they should seek cooling centers. And then utilization of the center by vulnerable populations is the optimal approach. And then the reduced morbidity and mortality is the desired outcome. So Samantha and I will talk a little bit, I'll cover this section, about communities responding to extreme heat. This is a very successful community-based organization that does have ties to Massachusetts General Hospital, Mass General Brigham, and very successful ties to the Dorchester, Mattapan, Hyde Park, and also Roxbury, of course, and also branching out to communities in Brockton. It's led by Dr. Reverend Vernon Walker, who's a graduate student at Tufts University, and he also has close ties with Boston University School of Public Health, which has a very successful grant history of working with communities, particularly around heat-related health outcomes. So it's an exemplar of community engagement. They have local leadership, empowering and allowing space for people with community-specific knowledge and relationships. They have equity in undergirding their work, actively addressing the historical and structural inequities that cause some, including low-income and undocumented individuals and communities of color, who are disproportionately threatened by climate impacts and marginalized in climate deliberations. Service and action is at their core, emphasizing concrete education, service, and planning initiatives that will engage a wide range of community members and foster long-term awareness and community resilience. And they work closely with the Mayor's Office and Climate Ready Boston. There are mutual benefits, so not only preparing neighborhoods for climate change, but also helping to make communities more healthy, sustainable, and equitable. And then collaboration, drawing on knowledge and experience from the widest possible set of stakeholders, including the civic, public, and private sectors. Of note is that the Boston Foundation and the Barr Foundation, both Boston-based foundations, have ties to them as well. And it's a grassroots program that aims to build equitable, inclusive neighborhood climate resilience in New England, starting in the greater Boston area, through hands-on education, service, and planning. This slide is really quite dramatic in demonstrating what we know about climate change-related health consequences. You can see heat at the center, the weather fatalities, and this is from 2021. Overwhelmingly, heat is the major climate change-related negative sequelae from climate change. And this slide shows 1971 to 2000 temperatures, and you can see that that range of years had only one day above 100, so that's a low scenario. But when you look at 2015 to 2044, the number of days above 90 degrees have grown dramatically, and also an increase in above 100. And then for 2055 to 2084, without dramatic action to ameliorate greenhouse gases, the numbers of days that are over 100 or even 90 and above are quite concerning. And this is just a pictorial view of the very dark areas, and you can see this coincides with inner city areas that are disproportionately impacted by higher temperatures because they're urban heat islands. So community institutions exist that help residents prepare for and respond to extreme weather events. So there's a photo of St. Stephen's Episcopal Church, which Reverend Vernon Walker has as a community resilience hub, and also the Boston Nature Center in Mattapan that's available as well. And this is a combined collaborative presentation by CREW and the Mass Audubon Society, Mattapan Food and Fitness Coalition, and Mass General Brigham sponsored it on how to stay healthy in the summer heat. And here's Reverend Vernon Walker and volunteers, and they're delivering air conditioners in the greater Boston and Brockton community to people who do not have air conditioners. And this is what's called a cooling pack, and it's a heat relief cooling pack. It includes cool patches, thermometers, and all kinds of cooling mechanisms that people can use in their homes or on the street. This is a paper that was published in the Journal of Climate Change and Health. It's a very fine journal, recently released journal. It's completely open access, so anyone can look for papers. Dr. Tina Duhame, Dr. Anne Christine Duhame at Mass General Hospital is the associate editor. This particular paper was published by Neil Segal, who's at the Institute for Applied Computational Science at Harvard, and Dr. Ashwini Segal, who's at the Center for Reducing Health Disparities at Case Western. So you can see they had a combined view of doing a spatial access, a geospatial analysis of cooling centers in Boston, and focusing on social determinants of health and reducing health disparities. And this paper actually showed, what was quite good, is that the analysis showed that 77% of Boston's population is located within a 15-minute walk of a community center or library with access to air conditioning. We do know that a 15-minute walk in high heat periods of high heat can be health threatening. So it's important to also consider that and seek transportation, which the city of Boston does offer. So Boston has done quite well in providing cooling centers. However, we do know that many people do not use them if they're solely cooling centers that don't offer other activities, whether reading in a library or bingo. So it's important to think about other activities offered in cooling centers. And then Samantha, I think this is you.
Yes, yeah, thank you, Patrice. So on this slide is an infographic that you'll see, and this is a scale from the Yale program on climate change communication. So this program stresses the importance of climate change communication, as this involves educating, informing, warning, persuading, mobilizing, and solving the critical problem, which is climate change. So the Yale program conducted a survey to measure how concerned healthcare professionals were about climate change. On the left-hand side of the slide, you will see there is representation of individuals with the highest belief in global warming. And the farther you go to the right of the scale, the less concerned the professionals responded about being worried about climate change. For the most part, though, a majority of the healthcare professionals from the survey reported being alarmed or concerned, as you'll see, regarding climate change, with respectively 26 and 27% of the individuals responding to those answers on the survey. There are, however, some percentages of the sample which did report being either disengaged, doubtful, or dismissive about climate change when asked.
Just advancing. There we are.
Thank you. And then this slide here that me and Patrice included is a diagram which represents how climate change cannot be extricated from systemic racism or from social determinants of health. So the diagram does a great job depicting how social determinants of health, climate change, and health itself are separate issues, but they do overlap. So therefore, it's important for healthcare professionals and members of the community to be mindful of this relationship between these 3 and 4 different factors. And this slide here stresses the importance to consider individuals or communities' reliance and their adaptive ability when it comes to climate change. So this helps us to visually see how when we're looking at different vulnerable populations or at-risk individuals, those specific individuals and communities can be negatively impacted by climate. So on the left hand of the slide, there are some writing in red that include examples of populations and individuals, which may require additional resources or support from the community to prepare for the impacts of climate change, such as the threat of heat. And then I'll turn it back over to you, Patrice.
Thanks, Samantha. So this slide is really incredibly helpful for thinking about social determinants of health and disproportionate impacts on those who are poor, BIPOC populations, etc. This is from the New England Journal of Medicine by Morello, Frosch, and Obisogi from March 2023. And you can see in the red at the top, there were housing and land use policies that were rooted in structural racism. So, for example, discrimination in real estate and lending industries, that's often known as redlining, dispossession of indigenous communities from their land. And these led to racial segregation, wealth and income inequality, and inequities in political power. And from there, what emerged, because of disparities in exposures to fossil fuel-related pollution and higher pollution levels overall, what emerged were what are called sacrifice zones. And these are disproportionate sightings of industrial facilities and highways in communities of color and low-income communities, whereas privileged communities benefited most from industrial pollution as solely producers and consumers, while they were able to avoid heavy exposures. Regulatory abandonment of racially and socioeconomically marginalized groups has happened across the country and is a major issue for disproportionate exposure. And then from there yielded the climate gap, racial and class-based disparities in the effects of extreme heat in particular, but also precipitation, drought, wildfire, housing loss, sea level rise, and displacement, all of which lead to unequal health effects. This slide is particularly important. It's a slide from a paper by Speroli et al. It's also published in the Journal of Climate Change and Health, again, a fully open access journal. And in the paper, they not only have heat exposure with an illustration like this, but they also have air quality and other climate-related health challenges that are very, very informative. So in this one, you can see that it's a pregnant woman of color, but they also touch upon other disproportionate impacts on women, most notably for women, for pregnant women, all pregnant women, but disproportionately Black women who are pregnant. There can be there are hormonal activity increases, there's onset of labor via dehydration and release of prostaglandin, oxytocin, and heat shock proteins from high heat, fetal growth restriction due to reduced blood flow and altered blood viscosity. There's an elevated risk of maternal blood pressure and also preeclampsia, as well as placenta previa and accreta. So the placenta can be impacted, leading to early pregnancy or dangers during pregnancy. There's also an increased risk of surgical site infections. And you can see on the left, the social and physiologic vulnerabilities include limited access to healthcare and cooling facilities, perhaps due to a lack of transportation and personal safety. And that can lead to a lack of cooling, of healthy cooling during extreme heat. There's also culturally prescribed heavy clothing and garments that women may wear due to their culture that can also decrease cooling. There's an increased risk of mortality in the elderly population during heat waves. So not just pregnant women, pregnant patients, but also increase in mortality. And then there's also decreased radiative cooling, which increases internal heat production with greater susceptibility to heat exposure during pregnancy, all of which have led to several very solid studies have shown an increase in stillbirths, congenital defects, and preterm deliveries. And of note is that if women are exposed to high heat and poor air quality, there's an exponential increase in adverse pregnancy outcomes for pregnant patients. In the patient encounter, what's important is to encourage use of local ambient heat monitoring tools and having a heat action plan, such as going to a cooler area, assessing patient access to air conditioning or cooling centers, discussing health harms and symptoms and behavioral changes, exercising caution in prescribing certain medications like medications that rid patients of fluids and anticholinergics and other blood pressure medications and psychiatric medications. For institutional and public health solutions, advocating for mitigation of urban heat islands, especially in regions with poor health center access, supporting hospital and clinic contingency plans, education of patients who come to the emergency department before they depart, collecting and disseminating gender disaggregated public health data, and increasing community communication and awareness of women's health risks locally, nationally, and globally to decision makers. So this is a focus on the schools. So as we shared this morning, it was quite distressing to see the broad swath, particularly in the Northeast, of schools in danger of extreme heat. This slide illustrates the Baltimore City public health, public schools. It was last updated August 31st of 2022, and likely the new data for 2023 are being updated. And you can see that they have public access for schools that will close or have early dismissal on extremely hot days, or that feel warmer due to a combination of heat and humidity. Schools not listed have air conditioning, however, may have to dismiss early if their systems require repair that cannot be completed within one day. So we often think about closing schools because of extreme weather, such as snow, but extreme heat is becoming a worrisome problem. And then this was in the New York Times. Hotter days widen racial gap in the US. So higher temperatures are linked to worse test scores. This was a very elaborate study conducted by Harvard researchers using PSAT scores because they're taken serially, and they found the test scores decreased significantly when there were high temperatures, high extreme heat, and non-climate controlled schools. And Black and Hispanic children fared poorer. However, white children attending public schools that did not have air conditioning were also impacted. This is from PBS NewsHour. The hotter the planet grows, the less children are learning. And I will share an anecdote. My older grandchildren I mentioned attends Boston Public Schools. And on her first day of kindergarten a few years ago, it was 94 degrees. Her mother was delivering her sibling on that day, and I went to pick her up at school. And it's an older air-conditioned school. The teacher looked wilted and the students looked wilted in a 94 degrees without air conditioning and the windows open. And it was soon after that point that I wrote to the superintendent of schools about the Harvard study around decreased test scores and lost milestones. And I'm happy to say the city of Boston has done a great job moving forward, even with older school buildings. And This one is the role of racial inequalities. There's a lot of terrific information. The Center for Public Integrity and Columbia Journalism has done investigations. They found that Arizona was the hottest state. Florida had the highest heat index with a combination of temperatures and humidity that really also disproportionately affects farmers that are often migrant farm workers and impacts their health. At times, they may start to engage in their farm work at 3 a.m. to avoid the hottest times of the day and end their farm work before noontime because of the dangers. There is also something called Mesoamerican nephropathy, which is particularly impacting farm workers, where if they don't have access to enough heat breaks and enough water, they can become chronically dehydrated and have loss of kidney function, which can actually impact kidney function to the extent that they need renal dialysis and renal transplant. Dr. Gora Basu at Cambridge Health Alliance actually shared at one point that he had a patient 26 years old who was awaiting renal transplant. It's a huge area of importance. The Occupational Safety and Health Administration has done a good job, but undocumented workers are at significant risk. We also know that there are higher rates of heat-related illness emergency visits and hospitalizations. The highest rates are in neighborhoods with history of racial segregation and redlining. And there is a document on dangerous heat, unequal consequences, how 2 neighborhoods in Arizona and Florida became hotspots for sickening heat that you can review. And in 1995 in Chicago, this was not well publicized, and it was before climate change really came to the forefront. But there was a tremendous heat wave that resulted in 739 heat-related deaths. Most were elderly, poor Black residents living in historically redlined areas. They lived in areas where there was a disproportionate amount of crime, and many did not feel comfortable opening their windows, nor did they have access to air conditioning. It was from July 12th to the 15th, and the combination of the temperature and the humidity, the heat index reached 125 degrees. There's an excellent documentary called Cooked: Survival by Zip Code, which I'd encourage you to look at. And Samantha.
Yes, so in addition, there are some language for climate change strategies that we want to include, such as mitigation and adaptation and resilience. And the differences between them: with mitigation, you're really focusing on reducing and stabilizing the levels of heat trapping greenhouse gases in the atmosphere, compared to, say, adaptation, where we're trying to reduce our vulnerability to impacts that are already currently existing regarding climate change. So, for example, increased growing seasons. Then there's resilience, so the ability to prepare and plan for, absorb, recover from, and more successfully adapt to these adverse effects. So kind of progressing from preparing to actually adapting and trying to reduce our risk. So there are health co-benefits to addressing these climate change impacts. So this would include increasing physical activity and also decreasing meat consumption, particularly with the meat consumption that is due to cattle and different livestock producing more CO2, and also meat versus plant diet. Plant diet is also very considered to be healthier.
And this is actually an assessment tool, a mnemonic, that a group of us in the Center for Climate Change, Climate Justice, and Health developed. And it's published in the Journal of Emergency Nursing. And it's called A Climate. And each of the first letters represents what an emergency department physician, nurse, social worker, case manager, occupational therapist, physical therapist, patient care associate. Everybody should think about when somebody comes into the emergency department, especially on a heat stress day. So A is for act immediately to stabilize life-threatening conditions. So if somebody comes in with 103-degree temperature, an elderly person who's been out in the sun and confused, you want to think about the possibility of heat stroke as the culprit. You want to consciously consider climate change as the etiology. You want to learn from a climate history, so you'll ask climate change related questions. For example, have you been outside? It's 95 degrees. Do you have access to air conditioning? Have you been in an air-conditioned environment? Have you been in a cooling center? Then the I is implemented climate-focused assessment. So you want to really focus, for example, if somebody confused with 103-degree fever, you want to think about heat stroke as the likely source, and you want to do a very focused neurological assessment while also thinking about, for health professionals, of course, while also thinking about, could it be in an elder, an infection or other source? You want to manage ongoing climate emergency care. If you're in the community, you know that this confused person with a high fever, you're calling 911 to get them the services they need. The A is act to integrate a plan addressing physical and mental health symptoms. And you want to talk to the person about how climate impacts their health. If you're in the community, a person living in the community, you want to let the elder know high temperatures and extreme temperatures, they may not feel so well because their sweating ability may be lessened, but you want to share with them why it's not really safe to be out in extreme weather. And in the hospital, of course, you want to educate patients in the emergency department. And then you want to educate and refer for long-term follow-up.
And so this slide here, we mentioned previously about mitigation, adaptation, and resilience in extreme heat. So this includes on this slide an infographic with things to consider, such as having the assessment, intervention, and evaluation by a healthcare professional, educating those about home dwelling, vulnerable populations, targeting that population specifically. Outdoor workers are at high risk for exposure and suffering from heat illnesses. Of course, the homeless population have less resources and ways to mitigate or adapt to these environments. And then, of course, also the Black population or other populations of color. We want to focus on those communities as well. And this slide here, so just recommendations for what individuals should do during an extreme weather event. We've noted a couple of these interventions prior, so such as using an air conditioning system and spending time in cold places such as cooling centers, but also places like malls or libraries. Patrice mentioned maybe not specifically designated cooling centers, but are good places to go and seek shelter. Using electric fans when temperatures are below 95 degrees, and this is great for people who maybe are unable to use air conditioning all the time due to utilities or other financial restraints. Again, taking those cool showers, using water to cool down, minimizing your direct exposure to the sun, and staying hydrated. And other recommendations that we should stress too is eating light, cool, and easy to digest food. So this would include fruits or salads, knowing the symptoms that we previously discussed regarding heat cramps, heat exhaustion, heat stroke. And then checking your local news or for health and safety updates. Like Patrice said, a few of the things we're educating on today just about the schooling system was broadcasted from our local system. So it's good to stay in touch and educated about today's issues. What not to do during an extreme heat event is also very important to be aware of and educated on. So we don't want to leave children, pets, or people with mobility problems alone in cars for any amount of times, as those vehicles can become extremely warm during these heat waves. Not drinking any alcohol or limiting your intake would help you to stay cool. Reducing your use of stove or your oven to cook, because it will increase the temperature of your house. And not eating heavy, hot, or hard to digest foods. Again, trying to find ways to physically reduce your exposure to heat and warmth. So reducing heavy, dark clothing, which absorbs heat from the sun. Exercising during outdoor hottest times, reducing that outdoor exposure, typically between 10 a.m. and 5 p.m. is the highest times. And again, that electric fan use, we want to use it when it's under 95 degrees, not over. So that way it's mid 90s, electric fan would not prevent that heat related illness, only air conditioning temperatures. And helping others, so just keeping in mind on your neighbor and other people in the community who you identify as being at higher risk of suffering from the heat. So that would include individuals such as older adults, sick individuals, or disabled people. Again, the homeless and young population still are at risk. School children, like Patrice mentioned, with their buildings maybe not having adequate AC or cooling systems. Athletes spend a majority of their time outside with some sports, so making sure they're seeking shelter when appropriate. And of course, our occupational workers and military personnel. So this slide here for healthcare professionals, just to be mindful of patient education and really trying to integrate or discuss climate change when appropriate. So focusing your education should be customized to the patient's risk factors or specific social determinants of health. So for example, as an oncology nurse, for my lung patients, try to educate them on the air quality. So especially with wildfires and the smoke we've had this summer, educating on when they should limit their exposure outside or proper precautions they should be taking when they need to go outside. Simple language is best, just to make sure that they understand the materials that you're providing them. And the resources, if they're on paper or if they're video resources, ensuring they are appropriate for the patient's reading level. And it's great to identify reliable organizations, maybe that the patient can go and seek on their own time, because there is a lot of information out there. So it's best if you can kind of guide them in the right direction. And in community education, it's important that we advocate for providing education in the community and make it a little bit more visible. So individuals working or living in areas that are at risk for certain climate change factors should be provided and have access to this information. So in the next slide, we'll show you there is a great poster that Patrice actually saw where construction workers had a poster and signage in the area to kind of prompt them to seek shelter and reduce their risk of heat illness. Other education materials such as signs and posters can be for other healthcare professionals or other occupations as well. But it's important to create those spaces to escape the heat, such as cooling centers, to prevent medical emergencies and negative impacts to individuals at risk. And again, making sure the signage, when it is used, is informative, simple, and provides the appropriate resources to seek out. And Patrice, I don't know if you want to say anything here, since this was actually a poster that you saw in the community.
Sure. So I was going on a boat cruise on the harbor one afternoon, and I at the seaport, and I went by and I saw Turner Construction had this incredible heat illness prevention plan. It incorporates a lot of what we've covered in this presentation. So you can see on the far left bottom, the heat index, the National Weather Service heat index. You can see the symptoms of heat cramps, heat exhaustion, heat stroke above that Samantha covered. They have first aid procedures. They did a fantastic job about following work and rest schedules. And they have water daily requirements. And then on the right side, next to the heat stroke sunburn circle, they have the National Institute on Occupational Safety and Health work rest schedule recommendation based on temperatures, which is really quite impressive. And then heat illness prevention measures below that, an unacclimated and acclimated work rest and water intake chart. It's so impressive.
And then lastly, we just wanted to also include, we've gone over kind of ways that individuals can reduce their risk or prevent themselves from experiencing some of the negative impacts of heat, but there's also opportunities for individuals and healthcare providers to advocate in their communities for change to happen to improve the current issues with heat-related illness. So there are several healthcare systems and government agencies out there who are motioning to help pledge to reduce carbon emissions. So a few of the ones we noted, recently the Biden-Harris administration did commit to reducing greenhouse gases by 50% by 2023 and net zero emissions in 2050. So a lot of the healthcare organizations such as MGB has signed this pledge. So it's great to see that more organizations and individuals are committing to this movement. And then there's also the Inflation Reduction Act, which was passed into law this past 2022. And this act was able to provide funds for clean energy and aims to reduce healthcare costs. Other additional opportunities that individuals can seek would include joining committees or boards at your place of work or community, which help to initiate such efforts, advocate for more sustainable medical supplies for those in healthcare fields, using low impact imaging for patients when possible. So just choosing which testing is necessary and taking in consideration which imaging or testing can actually have a larger impact. Choosing low carbon foods such as plant-based options. So this could be in your personal life or also in your place of work, such as a cafeteria. And there's also several climate change organizations and boards for those who are interested in joining.
And resources, and also publications from our center. Thank you.
Thank you so much, Patrice and Samantha, for a wonderful presentation. We are at time, but do you have a couple of minutes to address a couple of questions that have come in?
Yes.
We have an individual who is an older adult in fairly good health. Are they in danger of heat illness?
The answer is definitely yes. As people age, they sweat less, they have decreased evaporative cooling, and they may not actually recognize that heat is impacting their body. So you really have to count on hearing, for example, the weather forecast. If it's estimated to be 95 degrees, you may not sense that it's 95 degrees with high humidity, but you really must be aware of that because of decreased evaporative cooling.
Thank you. And are there any online resources one can go to learn more about heat cramps, exhaustion, heat stroke?
Definitely, there's the CDC has an incredible climate change page, very, very reader friendly. And you can just type in Centers for Disease Control and Prevention or CDC and climate change, and it will come up. And the US Environmental Protection Agency also has a lot of resources, and particular resources on climate change and extreme heat, what you can do to prepare.
Thank you so much. One last question. Are there any online resources one can go to learn more about the impacts of heat in their local communities, or even if those who aren't from Massachusetts, and what they can do?
In particular, Climate Ready Boston is a wealth of resources. And if you don't live in the city of Boston, you can still Google and put in your own town, because you likely would get information such as information about cooling centers, for example. Warning systems for extreme heat would likely come up in your own towns. But take a look at Climate Resilient Boston. It's a very robust. And the other thing I'll mention is Governor Healy just now has on her cabinet a climate change person, and I'm not remembering the person's name, but you could also look in the governor's resources for the Commonwealth of Massachusetts.
Wonderful, thank you. And the slides that you have shared with the resources, if anyone's interested in those resources, feel free to email the Blum Center, at pflc@partners.org, and we can gladly share those with you. All right, so before we end today's session, are there any final thoughts you'd like to share with the audience?
Thank you for having me. I was going to say it's been great to work with Patrice and learn more about this area. So, and I encourage anyone in nursing or healthcare professionals, if they're seeking other educational opportunities, climate change, it's worth investigating and be more aware of for your own and
professional organizations. And it's been a joy for me. I learned as much from Samantha as she did from me, I'm sure. Thank you.
Thank you so much for spending the hour with us. And as I had mentioned, this session has been recorded. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. It should be available within a few weeks. All right, everyone. Thank you so much for joining us. Have a lovely rest of the day.
Thank you, Samantha.